Hi everyone, I'm Dr. Cedrick, and today I want to talk to you about high blood pressure, some common misconceptions, and what my recommendations are. This is what the flow of blood looks like inside each and every one of us. When we breathe, we take in oxygen. This is what gives our blood its red color. Oxygen is then carried in the blood along with other nutrients and delivered to each and every one of our cells. In exchange, the cells release waste, carbon dioxide, and even ammonia. Now, this goes back to the heart. The heart pumps the blood once more to your lungs, where the carbon dioxide is exchanged for oxygen. This cycle repeats itself, and this is how we breathe. Within the blood, we find oxygen, all types of cells, water, nutrients, and even waste. The life of the body is in the blood, which serves as a highway, a conduit for the transport of things throughout the body. The content or the amount of things within the blood plays a role in the force required to push. The heart is a muscle. Like any muscle, it has a job, a function which requires it to be strong, to be healthy. On average, your heart beats 100,000 times a day, pumping the equivalent of 2,000 gallons of blood throughout the body. The effort required to push the blood is called tension. This tension can be measured using blood pressure monitors. When you use a blood pressure monitor, it'll display two numbers. The top number is known as the systolic pressure. This is the pressure in the arteries when the heart beats and fills with blood. The bottom number is diastolic pressure, which is the pressure when the heart rests in between beats. 120/80 is widely accepted as being normal within the medical community. Then there's stage 1 and stage 2 hypertension, each one being worse than the last. High blood pressure is not necessarily bad, but it serves as an indicator of how hard your heart has to work to pump the blood. High blood pressure is known as the silent killer because most people don't know they have it until it's progressed worse. Now, it'll often do its damage without creating symptoms, but when blood pressure numbers rise so high to the hypertensive crisis phase, you need medical treatment. Common symptoms of the hypertensive crisis include anxiety, nervousness, headache, and even dizziness, and even shortness of breath. There's an interesting phenomenon known as white coat hypertension. This is when patient will display higher blood pressure readings within clinical settings. Many people tend to get nervous or anxious when in a hospital setting. This anxiety will contribute to higher readings. This is so prevalent that studies have shown 1 in 3 people diagnosed within clinical settings are misdiagnosed. My recommendations: rest up, relax, and use a different setting, perhaps your home. There are a lot of misconceptions about the cause of high blood pressure. One of the most common is the salt myth. Let's revisit the content of blood. Arteries consist of 55% plasma, 92% of which is water. Our arteries have the ability to stretch open when full or constrict when depleted of fluids. The extent to which our arteries stretch open depends on the volume of fluid within it. When we remain hydrated, these arteries remain open. However, when we're dehydrated, they constrict to prevent the release of gases. Once your arteries constrict, they narrow the flow of blood. Your heart must now push harder. The question is, how do you hydrate yourself? Are you drinking sodas, juices, or are you drinking water? Now, salt has a bad rap for increasing high blood pressure. However, this isn't necessarily true. Salt is sodium and chloride, both of which are important minerals. They're important for our nerves to function properly, the heart to beat, proper digestion, hydrochloric acid, and it helps in the conduction of water. Our premise is that it's the salt type that we use. For example, table salt is commonly used in the American home. Now, table salt usually comes from underground mines. It's often processed with additives such as silica, dextrose, and even iodide. Silica, for example, will scratch your arteries. The body responds by elevating cholesterol production, which is deposited along your arteries to protect it. Now, this cholesterol deposition results in narrowing of arteries. Now, what I recommend is choosing sea salt. Sea salt are usually less processed, contain many more minerals, usually a lower sodium percentage than table salt. Now, I want to look at the root causes and make some recommendations. There are 3 causes of high blood pressure I want us to look at. The first coming from the heart itself. The heart is a pacemaker. It has the ability to contract on its own. Like any machine, it requires electrical energy to function. This electrical energy comes in the form of electrolytes. Electrolytes are minerals that conduct electricity when dissolved in blood or bodily fluids. These electrolytes include sodium, chloride, calcium, potassium, and even magnesium. Again, sodium and chloride make up salt, which helps in the proper functioning of the heart. The second being the deposition of cholesterol along our arteries. Now, cholesterol is deposited along the arteries in response to free radical inflammation or free radical damage. This cholesterol deposition results in narrower arteries. Now, the space within our arteries are narrowed, so the heart has to push even harder to get the blood through this space. I recommend increasing the amount of antioxidants within our diets. Then there's lifestyle. There are many sources of stress in our lives each and every day, with each one of these sources contributing to high blood pressure. Stress can come from your environment, your job, your social circle, and even the diet you have. So if you struggle with high blood pressure, I recommend doing these 3 things. First, increase your antioxidant intake. Antioxidants are compounds which reduce inflammation by removing free radical damage. They keep your arteries clean and healthy. Antioxidants are commonly found in fruits and veggies, but can be supplemented if we don't have the best diet. Some of my favorite include coenzyme Q10, alpha lipoic acid, your essential fatty acids, vitamin E and C, selenium, even quercetin. Then I want you to consider adding micronutrients to your diet, minerals in particular. Much of our soil today has become depleted of minerals, including our diet. Minerals are key for the function of virtually every part of our body, and I want you to focus on electrolytes in particular. And lastly, I want you to consider making some basic lifestyle adjustment. Find ways to reduce stress, ways such as prayer and meditation, not medication. These things can significantly reduce blood pressure long term. Add some joy and laughter in your life. Surround yourself with positive people and loved ones. A joyful heart does good for the body, like medicine. I want you to gradually increase your water intake, replacing sugary drinks, supplementing your diet when necessary. For more on that, check out drcedrick.com. In conclusion, I want you to understand that the life of the body is found in the blood. High blood pressure may not show symptoms until it's progressed worse. I want you to test yourself in a comfortable environment. Salt itself does not cause high blood pressure, but you can consider sea salt. Supplement your diet with antioxidants and minerals. These gradual lifestyle adjustments will yield big results. I'm Dr. Cedrick. Please like, share, and subscribe. Check us out at drcedrick.com for quality and affordable nutritional supplements. Thank you.